Welcome to Medcurity Live. Hello Facebook, hello LinkedIn, hello podcast, hello TikTok. Just kidding, we're not on TikTok, not yet. I am Joe Gellatly.
I'm Amanda Hepper.
And today we are going to dive into some aspects of the security rule. So HIPAA has been around for, as we know, 23 years now, so since 96. And in 2003, the security rule was released, which provided standards from the government on EPHI protection. So several areas of electronic patient health information, focus areas of safeguards. So today we're highlighting
Administrative safeguards today.
So what are the administrative safeguards? What is that distinction?
So the security rule describes them as policies and procedures designed to manage the selection, development, implementation, and maintenance of security measures to protect electronic protected health information and manage the conduct of the covered entities' workforce in relation to the protection of that information. So basically, covered entities must implement policies and procedures to guide employees in the proper care of EPHI.
So it's largely the paperwork part of this, isn't it? I mean, it's a lot more than that, but this is the guidance, the documentation to support a lot of what has to be completed and done.
The administrative safeguard, yes. In fact, good segue, the first place to start is to develop a plan, to have a formal documentation plan so that you can guide your workforce on how to handle that information. You need to have it, we recommend you have a consistent format so that there's a flow between the different policies and procedures that you have so that it makes sense, that they reference each other. We have seen oftentimes that clients may download a set of templates from the internet and from a variety of sources, and then there's going to be some conflicts that are just naturally going to occur with that. So to have a set of policies and procedures that naturally flow, that reference each other, that make sense. To have a set of policies and procedures, you don't need to have it be a lot of extraneous pages or verbiage. It just needs to make sense and cover the elements of the security and privacy rules. So we recommend you have a consistent format, that it's easy, that these policies and procedures are easy to find, that your employees know where to go to access these policies and procedures, and to define roles and responsibilities so people know what their particular role is. And does every workforce member have a role?
Yep.
Right. And so that's why it's so important that they understand where these policies and procedures are, that they become familiar with them when they are first onboarded with the organization, and that they are addressed as things change in your organization, and that they're reviewed on an annual basis.
Just a huge part of reducing risk, right?
Yes.
Because we've seen the policies and procedures referenced in a bunch of these case studies we've been dissecting where there's been a penalty or an event.
Right.
And it comes back to, you may have been doing the right thing some of the time, but it's not in policy. Or even if it is, your staff wasn't trained or aware of that.
That's exactly right.
So this
exactly
is a big,
right.
more than just paperwork in a binder. It's got to be a living, breathing part of the organization's function, right?
Right. And reasonable and appropriate for the organization. So.
Yeah. Yep. So policies and procedures. And then you mentioned roles. So in the administrative standards, there is a requirement for a security officer and a privacy officer.
Yes.
And we see in small organizations, someone gets the privilege of wearing both hats there. But this is something that has to be called out in the job description for whomever takes that role, right? So not just something that, this person's generally it, but it actually needs to be documented in a job description that this is our security officer who's responsible for XYZ. It's very well spelled out in the rule, and it's also something that I should have mentioned earlier, but much of the security rule delineates between addressable and required items, right? So we've got standards that there's not a choice. It is required to be in place as written, and then we've got addressable standards where, as an organization, we have to deem the best way to address the intent of that standard, even if it's not exactly as it's described. Got to have a security officer and a privacy officer.
Right, and your organization needs to know who that is. Who do they go to? when there is an incident that they've discovered, or if they have a question.
So important. It's part of the audits, and if you do your own walkthroughs, it's a good test if you're a larger organization to say, as you walk through the halls of the seventh floor wing, you say, do you know who to go to? And do you know who your security officer is? Do you know who your privacy officer is? Just to test that awareness, because that is critical.
Right. So another area of the administrative safeguards are security management. And elements of that are risk analysis, risk assessment, evaluation, sanctions, and an IS activity review. So basically, understanding, identifying where your risks are and what you're going to do to address those gaps. So, and risks can come in many different fashions. So it could be security systems, the IT, your electronic medical record system. Perhaps that could be a vulnerability if you have not assessed it properly. Clicking on a phishing email inadvertently, so not having the proper training in place. There's a plethora of vulnerabilities that need to be addressed.
Yes, yeah, absolutely, right. And so spelling it out, you're saying it's not just the technical controls, it's not just the tools that you install or the training, it's having a documented plan that is followed. What about auditing, auditing aspects of that as well?
Yeah, that's exactly right. So you need to know how your systems can audit themselves. So there can be audit logs in electronic medical record systems or other types of systems. You need to know what the capabilities are of your systems and then put a plan in place to utilize those audit features. And it may be a spot check. So if you have a system that perhaps doesn't have a robust auditing capability, you can say every quarter I'm going to log onto the system and I'm going to check 5 employees to see what charts they've been in, just to make sure that there wasn't any potential violation.
Right. So you can't just arbitrarily grab a few employees, but it has to be defined, right? Saying we're going to grab this many charts from these employees with this strategy, and then logged. We check these employees with these results, no risks found, or these risks identified, investigated, and then those logs have to be kept for. You guys know? Anybody know?
I do.
Kristen. Have to be kept for 6 years, right?
That's right.
So 6 years, and that applies to much of what we talk about. 6 years is kind of a standard throughout the rule of the logs that we keep, policies that have been retired, any of your documentation. So it's a good rule of thumb, different from medical records, but from a privacy security rule standpoint, 6 years is generally the rule.
Right. And I like what you were saying earlier about, so you have the plan in place, your policies and procedures are your formal plan on how you're going to audit your systems, right? And just because you have that plan in place, if you're not doing what it says you're going to do, you can be in trouble if there happens to be a breach, right? Or if there was a vulnerability identified when you do your risk assessment and then nothing is done with that. So
if you identify a vulnerability, work it into the plan and at least document when and how you're going to address that, right?
Right.
Vendor management, that's part of administrative, right?
Yeah.
Otherwise known as business associates and business associate agreements. And you can take that a bit further, but to start with the BAAs, having a business associate agreement in place has come up repeatedly as we talk about some of these recent breaches and penalties. So holding your vendors accountable, if they handle patient health information in any way, how do we hold them accountable and have them take ownership of complying with the HIPAA guidelines with that data that you're trusting them with, right?
That's right. And making sure you know who all your business associates are.
Yeah.
So.
Yeah, we had one example we talked about previously with Google. So they were using Google's calendar for scheduling patients for one of their this group's. I believe it was a procedure of some sort. Anyway, so online calendar using Google, they had an issue where an employee left and they forgot to shut them off. But the resulting investigation, as the OCR came in, revealed that Google, in this case, would be a business associate and there's no BAA signed. So being aware of any way that you're using outside resources to handle this data.
Right. And staying on top of your business associates. So if you have a business associate agreement in place with your vendor, that's good, but to continue to hold them accountable if there is an issue that they identify, you need to make sure that they are reporting that to you as soon as they identify that potential risk, and so that you can also take mitigation measures as well. So
huge. It comes up over and over again.
it does come up over and over again. So workforce, training is another huge piece. So to understand, to ensure all of that your workforce members are trained when they're onboarded, as we mentioned earlier, and that you are continuing to train them, and not just annually. We like to use a term to create a culture of compliance, so that people understand that if they see that they understand what incidents are, and that when they report them, that there's no negative repercussions from that. In fact, to encourage that is recommended.
To be paranoid enough to be aware of potential issues, and then to be comfortable enough to share them upstream, right?
Yeah,
and say,
well
this
said.
is what I observed. I may have messed up. I may have handed the wrong document or faxed to the wrong number. That annual training specifically has to be audited, has to be documented, right? So you need a log of when each employee completed training, because that is a required area. And you have to keep that log of employees completing training for, Jordan, guess, how long do you have to keep a log for? Okay, anybody? 6 years. It's 6 years. That's the answer. Anyway, so keep any kind of documentation for 6 years. And so that, again, is an area that we have to comply with. So you want to keep that record of employees completing training on hand somewhere where it is able to be accessed in case of audit.
Yep. On top of that, sending out monthly tips to your workforce. If there's a breach, to extract pearls of wisdom from that you can share with your workforce, all of that, just to create that communication going, to keep that going.
So one more big area, it would be contingency planning.
Yeah,
right?
Huge area.
And that's zooming out for a second, with HIPAA, we focus a lot on not accidentally or intentionally exposing patient information or patient information theft, but we're also required not to lose it. We have to protect it. And so contingency planning has a couple aspects. First off, the disaster recovery. So how do we come back from losing information or having it unavailable for a period of time? And a contingency planning includes, what do we do in the meantime? So if you need to see patients while your data is unavailable, while the internet is down and the EHR is unavailable, what are your procedures for doing that? And if you had an event where your EHR becomes unavailable, what backup process did you use? What restore plans do you have? Maybe it's all outsourced to cloud-based, but if you're storing any PHI locally, we need an ongoing plan to test those backups, right?
Exactly.
To walk through a whole plan.
To test the restore, to go through drills with your workforce so that they know what to do in the event of an emergency. Your vendors know if you have vendors that need to come on site to help restore systems, you have to have all of that outlined in your contingency plan. And if you have it outlined, then you know what to do and have tested it. Everybody knows what to do, and it is a much more manageable situation.
And it's so critical to walk through those exercises. Again, when we look at the phishing issues, so if I take one of these examples where phishing has led to ransomware, and when we hear about that and the ransom has been paid, it's because often, I've got a limb, probably not always, but often that backup couldn't be restored. So that testing of the backups on an ongoing basis, and go through the whole exercise of what a disaster looks like, and then log that you're doing that. So, and then how long do those logs have to be kept for disaster recovery testing?
6 years.
6 years, yes. So we need an ongoing record that this is something that we are ensuring that we have patient information protected, because when we can't restore it, then you're in a situation where you're losing the data or you're paying a ransom, right?
Right. And another thing to think about in this area is if your EHR is cloud hosted, so your vendor is managing that for you, include them in your drills, right? Yes. Make sure that you have copies of their disaster recovery plans, you understand what their backup plans are, and include them in your testing, so that if or when an emergency occurs, everybody's on the same page.
Any other critical items from administrative? We could go so much deeper in each of these, but trying to give some bullet points. We'll do the same for the physical category and the technical in the coming couple weeks. And probably dive into any of these. Send us questions anytime. welcome your comments.
Yeah, welcome your feedback. So have plans in place for all of these areas, test your plans, implement your plans, document that you are doing what your plans say.
Perfect. Okay, well, thank you for joining us on Medcurity Live. We will talk to you next week. Have a great week.
Yeah, see you next week.